Hey friends, this is Cassandra with my Apex Odyssey. I hope you had a great week this week. I actually went to the doctor this morning to urgent care because I've been having leg cramps like almost every night. Not leg cramps, I should say. It mostly happens whenever I go to bed, but it started happening during the day too. If I've moved my foot the wrong way, it'll happen in my feet and toes and like the very lower part of my calf. So I went to the doctor about that today. They checked my electrolytes, and all of the ones that have come back so far are normal, which is I think everything except magnesium. They haven't sent me a result for that one yet. And so I don't know what's causing those cramps. But I want to talk about what I've been eating. I mentioned before, I'm about to get ready for bed, so I'm greasing myself up, that I've added ferments to my food because I had to take some antibiotics for the eye surgery or after the eye surgery. And I have another prescription for antibiotics because another thing that I showed the doctor today was this bump on the back of my leg, and it's under the skin. It's like inside. You can't see it on top of the skin at all. And I'm just like, make sure it's not a blood clot. I don't want to have a stroke or nothing. And it hurts, and it gets warm, and it's red, which is some of the symptoms that it could possibly be a blood clot. But he messed with it, and he's like, that's a cyst under your skin, and it hurts because it's infected. So naturally, they gave me a prescription for oral antibiotics to take for 10 days or whatever it was. And I'm so torn about it. I'm like, I might just let it ride for a couple more days and see if it starts to get better or worse or what's going on with it. Because I don't want to take antibiotics. I don't want to take them again. But I also got to be able to walk and get around. It's not that bad. It's just really sore. It feels like a bad bruise. But it hurts when I just, I notice the pain before I notice the bump. Just from rubbing my leg or putting my pants on or something what did I do to myself? So there's this under there, and it's not above the skin, so it's not like I can put something topical on there. I'm like, can I put some tea tree oil on there? But the internet says it won't get down that far. Tea tree oil only gets down to the first few layers of skin, but it wouldn't get like under there, like way under there, to get to the source of the problem. So I haven't started taking them yet. I'm fighting with a surgeon over something, and he wants me to lose weight. And first of all, he wanted me to lose 15 pounds in 3 months, which I did. And I went and saw him, and we've got surgery scheduled for 6 weeks from now. He's like, okay, I want you to lose another 15 pounds. I'm like, what are you talking about? That's like, how many? Just 2 or 3 pounds a week. Which is, completely unreasonable under any circumstances. In the last 7 days, I have lost 6 pounds because I've changed the way I've been eating. And not because of that doctor, because of Dr. Lisa Wiedemann, is that her name? The eye doctor who does the cruises. She added some ferments to her eating plan and some other probiotic rich foods, but we just have some similarities in our situation. We're similar age, we're both in menopause, both have trouble losing weight, we both don't want to do sardine fasts, which I've done a few, and like her, as soon as I stop eating only sardines and go back to eating regular carnivore food, whatever weight that I lost and the amount of time that I managed to eat only sardines comes right back. And even fasting, you know, I can fast for a few days and take off a few pounds, but once I start eating what most people would consider regular carnivore for I'm within a few days that all comes back. So that kind of stuff hadn't worked for me. So I'm just trying some of the things that she suggested since her situation seems so similar. Eating lower fat. I eat some evenings. I eat like 7 to 10 ounce chicken breast. I get these boneless, skinless chicken breasts frozen in a bag from Sam's Club, and sometimes that's what I have for dinner. I slice it up. I eat it with the fermented vegetables, like a tablespoon and a tablespoon and a half, and I put some apple cider vinegar on there and salt. For my other smaller meal of the day, sometimes I'll have a couple of eggs. Sometimes I don't eat anything. Sometimes I just have some MCT oil. I also got some sardines and kippers. I can have some of that, which is, you know, not very calorie dense, but it's healthy stuff. And so I've been doing that for maybe 10 days or so now. And, you know, like, it ends up, I've been tracking my food intake too, so I know what's been going on, because now that I've changed things up, I'm curious what kind of a difference it's going to make. And so generally I'm eating a lot fewer calories than I was before, like usually under 1,000, definitely 1,200 or less. Some most days under 1,000, and some days under 600. And it just depends on what I eat. I'm not going hungry, and I still feel fine. Having some leg cramps. I mean, the foot cramps, like I said, but it's not my electrolytes. I don't know what's causing it. Could be neuropathy or you know, sitting all the time for my work, or you know, just no telling. It's under investigation, I guess. But yeah, 6 pounds in a week has been a long time since I've lost any significant amount of weight, so that feels like a big deal. And I will keep doing it as long as I feel good. The biggest measure of it is how I'm feeling. I'm feeling better than I have in a while. So I guess that's it. I'm tired. I'm ready to go to bed. It's 10:30 at night. So again, I hope you've had a great week, and I hope that you find a plan that works for you and lets you enjoy your best health. And I'll see you next time.